Quick test. I want you to look up at a bright white wall or look up toward the sky. And if you see little floating spots or cobwebs drift back and forth, then those are probably eye floaters. Now, I know you've got some questions because in the eye clinic every single day I answer questions about eye floaters, including are they dangerous? Will they go away? And what options do you have for eye floaters treatment? So, today, we're going to be answering all those questions. Hi, I'm Dr. Joseph Allen. I'm a board-certified doctor of optometry, and here on the Dr. Eye Health Show, we help people learn all about the eyes, vision, and finding the best vision products. If you like learning about the eyes and seeing your best, then consider subscribing to the channel so that you don't miss any of our future content. Question number one, what exactly are eye floaters? So eye floaters are usually a deposit of collagen building up inside the gel of the eye that we call the vitreous humor. And as light passes through the eye and hits this clump of collagen, it casts a shadow on the back of the eye, and that's why it sometimes appears that these little spots or kind of cobwebs drift back and forth, because they are suspended inside the gel of the eye. Question two, why do people get eye floaters? So for most people, eye floaters are something that occurs with age, and this is because the gel of the eye is mostly collagen and water. Kind of like our skin, the collagen does degrade with time. So people who are over the age of 50, 60, they're more likely to get eye floaters and have them develop. But I will say, for anybody listening in and you're younger, like I developed eye floaters in my early 20s, and that is often because of people who become nearsighted. Like myself, I was about a -5 diopters of glasses power in my early 20s, so that's probably why I developed floaters at a younger age. I will also mention that there are some rare cases of people experiencing the symptom of eye floaters, but they're due to something else, like a vitreous hemorrhage where there's blood inside of the eye, or they have a severe type of inflammation inside the eye from like a rare type of infection. That is possible, but for most people, it's just due to normal aging changes. Question three, are eye floaters dangerous? Thankfully, most of the time, eye floaters are not considered dangerous. However, about 5-6% of the time, when somebody experiences new eye floaters, they could have a tear or a hole or a detachment of the retina in back of the eye, because the gel will create a tractional force and pull on the thin, delicate tissue of the retina. And those situations are concerning to eye doctors because it can lead to permanent vision loss. Which leads us to question four is, when are eye floaters a sign of an emergency? Well, most healthcare professionals, again, if you tell them that you're seeing new sudden eye floaters, or you're having hundreds of new ones, that you're just seeing all these little spots suddenly appear, then that would be definite indication of calling your eye doctor and being seen for a dilated eye exam. Now, research, even a newer publication, did show that around 96% of the time, doctors just find, hey, they're just floaters, there's nothing more serious going on. But that does leave that 5 to 6% where it could in fact be a tear or detachment. And if you don't just have the symptom of new floaters, but you have floaters with flashes of light, that increases the risk of there being something more dangerous like that retinal tear or detachment. And that kicks it up to about 8 to 9% of cases. So if you're seeing new floaters, any new flashes of light, then definitely call your local eye doctor and get seen. Now, question five I get all the time, and that is, do they go away, and do they go away on their own? Initially, when people first start seeing eye floaters, they may notice them more often, but most people do report that they gradually sort of get used to them. Part of this could be because of gravity. As they first appear, gravity may pull them down out of your field of view, but mostly we attribute it to neural adaptation. So you're seeing something new in your vision, and then as you kind of settle down and realize it's not something to be that anxious about, your brain just starts to kind of learn to ignore them, right? You're more focused on everything else going on in life. And from clinical experience and what's published in the research, it's usually reported that it takes about 6 months to fully neuroadapt to them. Question six, can anything make eye floaters worse? Well, technically, no, not really, but some situations do seem to make them more noticeable for people. Again, while looking at like a blank white wall, looking up toward a bright blue sky, and being any situation where there's brighter lights. One example is I have patients who work in a computer all day. I've had patients who report they see a lot of floaters when they look at their blank kind of white backlit screen. So they've changed them to being in dark mode so they don't see the floaters as often. that might be something to think about. Question 7, are there eye floaters treatments now? Well, thankfully there are. The two most common ones that are recommended are that of laser vitreolysis or vitrectomy. Now, laser vitreolysis is a newer procedure where doctors will use a YAG laser to kind of zap and either fully remove or diminish the kind of appearance of eye floaters. It basically makes them less noticeable. This procedure, I think, is still not widely adopted, but is becoming more popular as an option as new protocols are being developed and new evidence is being published on its safety and efficacy. In fact, we did do a full Dr. Eye Health podcast episode where we brought on some of the doctors who were developing some of these protocols. So if you want to learn more about that procedure, some ins and outs, as well as hearing directly from an eye doctor who got the procedure himself, then I will link up that podcast episode in the show notes for you. The other procedure, called a vitrectomy, this is the more invasive procedure where surgeons will remove the gel from inside the eye and replace it with an alternative. And when they remove the gel, it removes all the floaters along with it. So this has a higher chance of completely removing the floaters, but it does technically carry a higher risk of complications with it. Now, a publication of 61 patients, they reported only one case of a retinal detachment that occurred post-operatively, like immediately after the procedure. But then over the course of 24 to 44 months, they reported another 4 eyes developing complications, like a retinal detachment. And it was a total about 5 to 6% of the eyes. However, while there are that reported case of complications, they have also reported a dramatic reduction in glare and symptoms of floaters. It's like 85 to 90% of people who have a vitrectomy do report that they are happy with the results. I will report one other newer study of 142 eyes. They found similar success, but they did report a recurrence of floaters, which was interesting, in about 31% of the eyes. So some people can still be symptomatic for floaters even after a vitrectomy. One thing that should call out, if anyone's kind of interested in vitrectomy, having it when you're younger, when you still have the natural lens inside the eye, that does increase the risk of developing a cataract. So a lot of eye doctors, especially retina specialists, if you want to go consult about having either laser vitreolysis or a vitrectomy, they're going to be weighing the kind of the cons, the risk versus the benefits. And still, in my personal experience, I find most doctors that I refer to or collaborate with, they don't recommend this for many patients, especially when they're young. But always worthwhile having that conversation with your eye doctor. Question 8, how do I cope with or how do I reduce eye floaters naturally? So there's kind of 3 main things I want to mention. First, I think just getting an eye exam is really important because then at the very least, you can confirm with the doctor that there's no signs of a hole, a tear, or detachment of the retina. And that right there can reduce a lot of anxiety for people. And we do know that when people have high anxiety, they tend to notice these spots in their vision, or they're a little bit more hypercritical about things in their eyesight more. And so that might reduce anxiety and give you a better chance to neuroadapt over the course of, again, about 6 months. There are a couple other options that doctors can offer that are supported in the research. One of which is that of low-dose atropine. This is 0.01% atropine prescription eye drops. This is shown to dilate the pupils a slight amount and reduce the size of the shadow that's cast from the floater into the retina. And so people just don't notice the floaters as often. It doesn't treat the floaters themselves, but it helps reduce the symptoms. And a recent publication did show that it's about 50% effective. And I would say that's kind of on point to my clinical experience prescribing it as well. The last and final option is there are some eye floater supplements on the market now. There's several of them that you can find online. There is one that has some published clinical evidence using the exact formulation. And I'll link both not only that eye floater supplement, but also the research down in the show notes in case you want to read into it. The kind of newest one that's on the market, I think is interesting because they're kind of combining multiple different publications, but they do not have a clinical study using that exact formulation available right now. In my clinical experience, I would say Yeah, a lot of patients who take those floater supplements do report that they notice less symptoms. It's tough for me to say, was it placebo effect? Was it truly effective? But at least the publication that came out does give eye doctors more hope and support that it's not only effective, but is also safe. But definitely let me know in the comments if you've ever seen these products, if you've tried any yourself. Let me know kind of what results you've had. Now from here, if you have additional questions that were not covered, then drop them in the comment section, because I do try my best to answer and read as many questions as I possibly can, or they get turned into a full episode. But from here, if you want to learn more about something like laser vitreolysis and have not heard our episode with Dr. Paul Singh and Jeff Bonas, then check out that full episode of the Dr. Allo podcast, and we'll link that up right over here. Otherwise, thank you so much for being here. Keep an eye on it, and we'll see you in the next one.